Our company normally is in medical IT, so we are delivering solutions for physicians, for hospitals, for pharmacies across Europe. And we have acquired a company who's in this business already for almost 10 years. We acquired them some years ago, and they had a very interesting product for virtual patient simulation. And so we are now in this business for 4 or 5 years approximately, and mainly in the university field and also in the CME field. There's a system, there's a workflow behind it, how you can create virtual clinics, how you can create virtual patients, so that it's really very close to reality. And all the authors, we need the medical authors who are behind it, and there's an editing tool, and they can edit the patient based on the workflow, so they can add files, they can add findings, they can add videos, whatever they like. Yeah, that's true. So in a way you can tailor your patient according to your needs. Particularly, it's interesting for rare diseases. If you don't have these patients in reality, you can create the virtual patient, and you can learn about diseases which you normally are not seeing on a daily basis. So let me explain. For example, one of our largest customers is the German Army. It's for the education of their physicians, and they are active all around the world. They're in Afghanistan, they're in Africa, and sometimes they are with diseases and also with injuries they don't see in Germany in reality, so they need to be trained, and that's where we're using virtual simulation. Of course, we make some surveys where we always have an administration, so we can see how long the people are using it, and we're making surveys about students, how much they like it. And the thing is, even the students, everybody needs to get forced to really work with a tool, just to tell the people, oh, here we have a nice tool, work with it. That doesn't work. So the teachers, the doctors, they need to be behind it, and they need to run really a course, and there needs to be an interactive blended learning course where they discuss about the patient. Just to leave somebody alone and say work with it, it's not a good idea. We're trying to work closer. There's already medical simulation, but medical simulation is very strong. What we figured out, at least in Germany, it's, for example, in emergency and anesthesia, in ICU. There it's really very absolutely necessary that you do a lot of simulations. You should simulate things which you don't see in reality. It's like with a flight simulator. You have to simulate those situations which are not happening during a normal flight. For example, a fire or any kind of emergency case. And there we see a lot of potential, and for example, we are now starting a project in Germany which is financed by governmental funds for child abuse, so that physicians can see whether the child was abused, whether it was a normal injury, and whatever. So there's, I think, a lot of opportunities in the future.